Hospice House Brookside was opened with the goal of serving the patients and families that live in northern and mid Pinellas County in need of inpatient hospice services. The house was really visioned years ago to be a place that would be both caring sanctuary and medical expertise for those who need that kind of care. The house is a 30-bed home with private rooms and bathrooms, staffed by the entire hospice care team, including medical directors, nurses, counselors, volunteers, health aides, kitchen staff, anybody who's needed to really meet the needs of the patients and their families. The house is open 24 hours, 7 days a week. We take admissions anytime, and we also have visitors anytime. We were privileged enough to build the house with consideration of both patient and family needs. The house has ample space for privacy in the room. We do have families who spend the night. We also have a lot of community space, and we've seen some naturally forming support communities within the families of the patients as they've come in and spent time in the family rooms, in the hearth room, walking along the boardwalk of the property. There's been wonderful, wonderful connections made in the house. Our mission has stayed true, and that's really care for patient and family with a high standard and a high quality of excellence.
We are also professionals, and so we bring with us a wealth of knowledge and experience about hospice care. When we approach a patient-family situation, we begin our care by just being present and listening and determining through observation, through skillful interviewing and assessing what it is that their needs are. To just be present and have an entire team of professionals, whether they were nursing, physicians, psychosocial staff, chaplains, aides, volunteers, we were all focused on that patient and family and what their need was. The patient and family stay at the focus of our care. Their wishes, wants, and needs are considered first.
We see people here who come in at the very end, and we see people who are here maybe for pain management, so they get, we give them a tune-up and they go home. What can we do? What is it you want? And we'll help you do it.
Good spiritual care is really good listening, asking thoughtful questions that are respectful, and making sure that our posture, our quality of listening does not contain any judgment. We're not here to judge anyone or to make anyone feel guilty about anything, but really to meet people where they are and to be a good companion, a trusted companion with them. And that's what I believe spiritual care is. And so asking that question, what is important to you today, is really a part of caring for the whole person. The hospice houses are designed to be places of hospitality and comfort. And so the rooms are very generous, and each of our hospice houses actually has what we call a sanctuary, a place for private prayer, a place of quiet, a place where someone can meet their grief.
Treating the person from body, mind, spirit standpoint is one of the important things that I see that benefits patients. It's not just the patient, it's the families that are important too, because that is the extension of the patient. And we have to have everyone on board, what the plan of care is, what the goals are for the patient, because every patient and families have different goals. Our goals are what the patient's goals are. And a lot of times, patients come in and they look at the physician to direct the goals of their care or what they should do next. But here, what we do is we allow the patients to have a say in what they want to do. For Brookside, it feels very comfortable. It's a work environment where I step in and it feels good to be here. The staff that we work with, they're very knowledgeable, they're very understanding, they're very caring. And if I had to say one word, I'd say caring is one of the things that you feel a lot when you come here. Again, not a lot of people know about what hospice really is, what palliative care is. If you have questions about it, talk to us, because we're there to explain things. We're there to educate, and that's what we like to do. Make the call. That's one of probably the hardest things to do, is to pick up the phone, call, and ask for help, because whether or not we can help, we'll listen.